Yeah, I hope everyone join us and welcome to such a global medical training day. So today we will discuss about basics of aviation medicine. So welcome Sydney, welcome Bangkok, welcome Madrid and Prague. Yeah, someone here online, someone here offline. So welcome on board. Yeah, and please mute your microphones, and you will have a chance to use it when we're gonna have some interaction, when we're gonna discuss some points, and when I need your feedback. Yeah, so I will understand that you are participating in my training. Okay. Today we discuss about some history of aviation, about gas laws, about flight physiology, about medical conditions which are related to flights, how we can travel, how to arrange, and we will have opportunity to questions and answers section. So many cameras. Okay, let's go to the history. Yeah, do you know these two guys? Yeah, Daedalus, Icarus and Daedalus. Yeah, it was the first legend and the first history when people are trying to fly. Yeah, Daedalus created two pairs of wings from the fur and the wax to run away from the island. So, and it was only two rules what to do. Actually, it's the first in history, in world history, when people create aviation regulation. When you don't need to fly too low, otherwise your fuel will be too wet and you will die. And don't fly too high to the sun, otherwise wax will be melted and you will die. Yeah. And unfortunately, here is the first example. Then guy not follow aviation regulation. Icarus, he was so high to the sky and wax been melted and he died. Yeah, it was Icarus. But it was a legend. And in real life, we start fly with balloons, lighter than air era. So in history of Jules Verne, when they flying around the world, and when trip took from London to India, approximately a few months, yeah. But it was the first attempt people to travel really. And the next step is heavier than air era with the Wright brothers. It's just like a bit more than 100 years ago, when they start to fly with the aircrafts. And we celebrate 3 years ago already, Royal Flying Doctor Service, 90 years, when they start to use aircrafts to transport patients and provide medical treatment. Another era, another step, it was Second World War, when aircraft start to be used to transport patients, and 1.5 million patients being transported with the fixed-wing aircrafts. Another two wars, it's Vietnamese and Korean War. They start to use helicopters to transport and evacuate patients. And currently, we are in modern era when we use aircrafts, helicopters, jet aircrafts on daily basis, including transport of the patient. So we can move patient from USA to Spain just within 7 hours direct flight. Let's go next. So it's so many laws, yeah, physics laws. We are not going back to school to physics, but I will just touch a few and you will understand why it's so important for us. From easiest one, yeah, we've got some atmospheric pressure on the ground level, on the sea level. If we are going up, it will be less atmospheric pressure, yeah, because less atmosphere press, because we are going up. And one of most important in aviation medicine laws is Boyle's law. If we are going up, it's less pressure outside, so gases which are inside us or inside of any cylinders are expand. Why it's important? I will show you example. Yeah, this is bottle on the ground. This is bottle when we are flying, so it's expand. Just imagine we've got some trapped gases in our body. Yeah, after surgery, after injury, and if we are starting to fly, this gas will expand. It's important for conditions like a pneumothorax, when air in our pleural cavity. It's important after abdominal surgery. So in case if this gas still persists in our abdomen or chest or even the brain, after brain injury, it will expand. In easier case scenario, it will be pain. In more serious conditions, it will be death. So all gases inside the body after surgery or after certain condition should be absorbed. Yeah, it's a Boyle's law. Dalton's law. We've got low atmospheric pressure, high atmospheric pressure on the sea level. If we are going up to Mount Everest, it will be less atmospheric pressure. If it's less atmospheric pressure, we will have less oxygen molecules. Because just imagine, here we've got 21% of oxygen. Yeah. On the Mount Everest, we will still have 21% of oxygen, but oxygen molecules will be in this area. Yeah. What does it mean? It means for patients who require oxygen on the ground, they will require more oxygen they're going up. Go to the mountains, or for us, go for international flight. If patient requires some oxygen on the ground, he will require more oxygen during the flight. So please think about it. Charles' law and Gay-Lussac law, it's easy description. Going up, it will be cold. If you are flying with a patient, please try to make them warm. It's more important for newborns because the mechanism of the thermoregulation, it's not ready. Yeah, that's why we use incubators for transport newborns and preterm babies. Fick law, it's all about membranes. Yeah, we are going up. Membranes here is like one of the most important for us. It's alveolar tissue. Yeah, where oxygen go from the air to our blood. Because it will be less pressure, this membrane becoming thicker, and it's more difficult oxygen molecules to penetrate to our bloodstream. What does it mean? Patients who suffer from such condition like pneumonia or congestive heart disease or COPD, they will require oxygen. Even they are not required on the ground level, they will require during transport. And patients with pneumonia, we should wait there when they are recovering. Yeah? Otherwise, we will need to arrange oxygen and escort and everything. So better to wait a couple of days instead of arranging oxygen. Who knows this guy? Bragg? Yes, yes. Jacques-Yves Cousteau. Yeah, he's the father. He's the father of scuba divers. Henry's law, it's about decompression disease. I will not go so deep, but people after diving should not fly. Yeah, they should wait 12 to 48 hours. Patients who suffered from decompression sickness, from caisson disease, they should wait at least 3 days after last decompression sickness. Yeah, otherwise these oxygen bubbles will appear in the tissues. It can be pain in muscles, but it also can be damage to the brain. Hypoxia. Okay, I will ask non-medical staff, what is hypoxia?
You can suffer when you lack of oxygen.
Yes, lack of oxygen. Yeah, lack of oxygen. So how it can affect? We will go with some heights. Yeah, if we are going up, probably first symptoms we will start to feel when going to be 2.5 thousand meters. If we are going above 3,000 meters, we will start to be drowsy, we will start to feel like we are tired, we are not that efficient. If we are going further, up to 6,000 meters, it will affect our circulation. Yeah? And if we will stay there for a long time without oxygen support, we may die. Yeah? Because oxygen is really necessary. And this oxygen, because of lack of oxygen molecules, yeah, over there. And how we can be effective, yeah? It's just altitude. For example, 40,000 feet, it's approximately 12, 13 kilometers, where usual aircraft like Emirates or Etihad are flying. And how long we can be effective, yeah, when our brain is still working. It's just a few seconds, yeah, following rapid decompression. So, and what shall we do? How we can fight? Take oxygen mask and start to breathe, yeah. So oxygen will save our life. We know some crazy mothers which are saying, "Oh, I will take about my child first. Yeah, my child's life is more important than mine." If she will try to take this mask, put on the face, it will not be enough time. So she will pass, child will pass, and they will die. So take care about yourself first. Yeah, like in real life. And here is effects of flight. Yeah, temperature, vibration, and noise, especially in helicopters. Decreased humidity, because in aircraft air is dry. Yeah, and why it's important? Because you are losing water when you are breathing during the flight. Why it's important? It's important for people who cannot drink normally. People who suffered after stroke and cannot drink during the flight, they're losing the water. And it can make the condition even worse because less circulation. So we should think, shall we provide some IV fluids during the flight? Shall we put an NG tube for it? Another amazing example of decreased humidity, when girls are flying from Madrid to Thailand. Yeah, it's a 12 hours flight. After they arrive into Thailand, they say, "Oh, I'm in a good shape." Yeah, and they're buying swimming suit, and unfortunately in 2 days, this swimming suit not fit anymore. Yeah, why? Because we lost some water. Yeah, we even can lose 1 or 2 kilos during the flight. It depends how long it takes. So, just advice: when you are flying, drink more water. And when you arrive into Thailand after a long flight, please wait a couple of days before buying swimming suit. Immobility. Yeah, it's not a place to run during the flight, but for us it's more important for people who cannot move normally, because it's high risk for DVT. Yeah, everyone knows that it's deep vein thrombosis. And the pressure ulcers, but pressure ulcers is more for stretcher patient, and it's for medical escort how to manage it. But for DVT, if patient immobilized, we should think, okay, we should provide some kind of prophylaxis, yeah, especially for people who got injured legs or injured that much, so they require stretcher transport. Closed space, yeah, some people are claustrophobic, just for you to know. G-forces is more important for jet pilots, but you can see effect of fly how the guy who got experience to be a pilot of jet aircraft, he's really enjoyed. Fatigue, probably you will not be able to run marathon after 10 hours flight. And atmospheric pressure, we already discussed, including hypoxia. Flight and medical condition, all gases, any gases must be resorbed, to avoid expansion. In case of pneumothorax, injury of lungs and ribs, it should take at least 2 weeks after full lung expansion. Abdominal surgery, it takes 5 to 10 days. Otitis media, as soon as we able to clear our ears, to blow it, usually it takes 1 to 3 days after beginning of the treatment. Fractures, we should avoid full plaster cast, and we should wait couple of days, because there are possible complications like compartment syndrome or neurovascular deficit. Anemia. Okay, tell me what is anemia?
Lack of the red.
Iron, not exactly.
Lack of the hemoglobin.
Yes, lack of hemoglobin. Yes, good. And what is hemoglobin? Hemoglobin is a thing which transports oxygen inside our blood. So, for example, hypoxia can be related with a lack of oxygen in the air, but hypoxia also be because of low hemoglobin. And when we are flying, when we will be low oxygen in the air, if we will have an anemia, we will suffer from hypoxia. So it's certain level when we should have it in our blood of hemoglobin. So it's 8.5. If it's lower, patient not going to be fit to fly or require supplementary oxygen. Or we need him to make more hemoglobin in the blood so we can make and arrange blood transfusion. CVA, stroke. Stroke usually means that it's already less when brain is suffered from hypoxia, from different reasons. So we should wait at least 5 to 14 days before patient's going to be fit to fly, and in certain conditions we need supplementary oxygen and nurse's call. Myocardial infarction. Myocardial infarction when our heart is suffering. Heart is our pump. It's our muscle which move oxygen around our body. So if our pump is not working, we will suffer more from hypoxia. So it's usually 10 days, but condition may apply, because if we will have a proper treatment like coronary graphy and stenting, it could be less, but it will depend on actual condition of the patient. Infection disease. Infection disease, why it's important? Because you cannot fly when you can spread infection. For chickenpox, it's usually 7 to 10 days. For whooping cough, 3 weeks. After symptoms, 1 week with antibiotics. So usually it's 1 week. Tuberculosis, 2 weeks after beginning of treatment and asymptomatic. Why tuberculosis is so questionable? Because we've got a couple of cases when it was in Australia, when patient got this diagnosis from the doctor, and doctor said, "You are not fit to fly for 6 months because of the treatment." No, 2 weeks, and asymptomatic patient will be able to fly. Another example was in India. Patient got diagnosed with tuberculosis, doctor just prescribed medication, said, okay, you can fly. No, you can spread infection, so wait 2 weeks and wait improvement to be asymptomatic. Influenza, 3 to 5 days after onset. Ebola, MERS. I put here special consideration with airlines, but no. Yeah, patient not going to be accepted on board of commercial aircraft with this. And our favorite now. Yeah, we are living in COVID era. If patient is active and symptomatic, he will never be accepted. And moreover, if patient got COVID positive and require transport, probably we should think AA flight, yeah, in a special setup, yeah, not to spread an infection. Now we've got country specific. So patient, even he is negative, he probably will not be accepted on board without test or special test or recent test. In some countries it's 24 hours, in some countries 72 hours. If you are going to fly to Thailand, you should have a negative test, you should have an insurance, you should have a pre-booked hotel for 2 weeks to stay there. So now it's country specific. You can check with our transport team because it's changed day by day. Antigen test. Recently I've got the question, but patient got antigen test and he got antigens, yeah, but he still can be positive. Yeah, PCR still can be positive. So PCR is only test which show that patient got active infection or no. And what we will have in perspective, yeah, in most of countries they start in vaccination, and we will hear in few months about vaccination passport or COVID pass, COVID antigen pass that you already suffered from that. But it's a perspective, we will see it, and probably we will update you what's going on, because it's going to be important for travelers. Okay, how we can travel? We can travel commercially or we can travel through air ambulance. Yeah, with air ambulance, easy. We've got helicopters and fixed wing aircrafts. With commercial flights, we can fly with economy class, with extra seats, with business class, first class, stretcher, and Lufthansa PTC. I will show you what is it. Okay, who knows that? Mesh, okay. I know that in Bangkok no one knows that, somehow. You can fly with escort or without escort. So, some people, normal people or recovery after acute disease, they don't need escort. Non-medical escort, when patient need some help, go to toilet, with feeding, to help with luggage, it will be non-medical escort. If we need some procedures like a change, dressing, take care about catheters, take care about some sanitary needs, we will need nurse escort. When patient condition can be changed, we will need doctor escort. And in more complicated cases, we will need and doctor and nurse escort. Economy and business class. Why it's different? Yeah, economy is usual aircraft seat. Yeah? You can sit as normal, but sometimes patient's condition require extra comfort. And when medical team advise business class, we can expect several things. lie, yeah, completely 180 degrees bed, yeah, to lie down during the flight, to relax, to put legs up. But in Europe, we've got European business class, yeah, and compare with Emirates, yeah, European business class in EasyJet will be equivalent as a economy class seat in Emirates. Yeah. So we will need to specify what we are going to request from business class. Yeah, so it should be extra space, flat bed, or just leg elevation. Otherwise, we will go with extra seats. Okay, how to choose economy class? Yeah, first question. Can patient sit upright for 30 minutes? If no, it's only stretcher an option how to move the patient, because patient cannot sit even like for takeoff and landing. Can patient be in non-horizontal position for a whole flight and no need extra space? It will be just as simple, yeah, economy class. But if need extra space for equipment or to expand arm, leg, we can order extra seats. If patient cannot sit upright for a whole flight, we can check if 3 flat seats, so 2 extra seats are available. We can arrange 3 seats, so seat and 2 extra seats. If business class is close to horizontal, like a flat bed, we can arrange business class. If on this route there are no that options, we will go again with the stretcher. Okay? Yeah? That's clear. Good. What to do with extra seats? When you've got broken leg, it will be 3 seats. So it's 2 extra seats. 1 for patient, 2 for leg. If it's arm or shoulder injury, we will have 2 seats. So like a seat for patient and 1 extra seat for arm. 3 seats to lie down. Yeah, in case of business class, flat bed is not available. Yeah, so it will be seat for patient, 2 additional, 2 extra to let him down. In some aircrafts, it's only 2 and 2 seats. In that case, if we require 2 extra seats, we cannot arrange it. Yeah, we cannot let patient to put his leg into the aisle. So we need to change aircraft or airlines and arrange something else. Never emergency exit. Yeah, aircraft will not allow patient who is not gonna help and cannot fly normally and cannot open the door in case of emergency to fly with the emergency exit. And in case we are arranging extra seats, we must collect all boarding passes. Why it's important for coordinators? I will give you one example. We arrange for a patient 2 extra seats because of broken leg after surgery, and he checked in, came to the aircraft, and he discovered that he got neighbors. Why? Because he did not notify check-in staff that he got 2 extra seats. Yeah. In that case, it was a complaint, but yeah, patient should inform about it. But our work as assistance company to inform policyholder, please take all boarding passes because you can notify check-in staff that you've got extra seats. Yeah. Wheelchair. Sometimes we require wheelchair. And let's go with this ladder. Yeah, can patient walk all day without wheelchair? No need. If patient required but still can go upstairs, it will be WCHR. Yeah. If he cannot climb up but still can go 30 meters, so inside the cabin, it will be WCHS. Yeah. steps. And if he cannot go inside the cabin, it will be WCHC, yeah, to the chair. Yeah, it's the most difficult. If like here we are not require medical clearance, WCHC will require medical clearance like almost always. And stretcher. What is the stretcher? Yeah? So you can install usually in the end of aircraft, above seats, special setup. Yeah, it's not that much space. Unfortunately, not all airlines can do it. It always requires medical clearance, so you cannot do it like. I'm promising you will have it tomorrow. Yeah, it requires medical clearance. It requires confirmation from airlines. It requires tarmac access. And the important point is weight limit up to 140 kilos. In Asia, 120 kilos. So if we will have a patient which is going to be 180, we should think other route. Yeah? Probably it will be air ambulance if he will fit into the door. Or more expensive air ambulance with a bigger door. No. There is the, yes, okay, yeah. And there are airlines which provide this service. My favorite type, but Turkish are the best because they can do it fast, without unnecessary documents, and they are, I think, ideal in terms of arranging medical clearance. They are not always required, and our transport team can confirm it. Okay, oxygen on board. How we can get oxygen for our patient? Mainly, we will never have access to that. Yeah, it's just an emergency oxygen. Oxygen cylinders we can request from airlines, so they will give you oxygen cylinders prepared on board, and you can utilize it during the flight. Portable oxygen concentrator. It's a special machine which generates oxygen. That's 3 sources. And oxygen on board will always require medical clearance. There are 2 possibilities: continuous oxygen or intermittent, when patient will require dependent condition. Not all airlines provide with the oxygen, and not all airlines allow you to use oxygen, even a portable oxygen concentrator. Official possible flow is 2 to 4 liters per minute. If patient admitted and required 6 liters of oxygen per minute, he will not be accepted on board, because it's a too high flow, and the oxygen demand will increase during the flight. POC will require 150% of battery life. So if we will have a 10 hours flight and one battery lasts 6 hours, we will require 3 batteries. It's maths, don't worry. And POC should be approved by FAA, but most of them are. And here examples. It was long time ago when you have access to emergency oxygen. Now it's not exist anymore. Here is oxygen cylinders from airlines, and here example of different oxygen concentrators which you can take on board. It's not that big. Some of them are huge, some of them are small. Lufthansa PTC. I think better to show you. It's a special setup. It's a passenger transportation compartment. Here you can see it's real ICU. Yeah, they can provide with high flow oxygen, they can provide with a ventilator, they can do suction on board, they've got some basic medication to support patient over there. And here you will never know that a patient over here, yeah, because they put this special setup. And it's provided for long-haul flights, and it's cheaper than air ambulance. For me, easier to say it's cheaper and more convenient. We've got one case from Cape Town to Frankfurt, and we use Lufthansa PTC. In case if we utilize air ambulance, it will be, I think, 240,000 euros and 5 stops. When we use Lufthansa PTC, it cost for us 55,000 euros, and it was direct flight. Yeah, it's more convenience for patient. It's more cost effective. And you can combine with some other air ambulances. We've got example when we transport patient from New Zealand back to Germany. So we use 3 stops air ambulance to Singapore, and after that was a direct flight to Germany. So it's a good alternative to air ambulance, but it requires special medical clearance, and it takes time. And during COVID situation, Lufthansa PTC pre-booked for next 2 or 3 months. Yeah, but I hope situation will change and we will use Lufthansa more. Lufthansa PTC already includes some medical technician, yeah, but still we should provide with escort. It should be doctor and nurse, yeah, because it's flight not for 2 hours, and they need to change and they need to take care about the patient. So we arrange a doctor and nurse for Lufthansa PTC. Yeah, they've got medical technician which can help, but it just like to show how to manage with equipment in this unit. High lift, yeah. Favorite airlines of someone. It's how to put patient over there. Yeah, you see a small ground ambulance and a high lift which help to load. Yeah, and it's required tarmac access. So all cases with WCHC with a wheelchair to the seat, or all stretcher cases, they use this high lift. Fitness to fly, how we can decide? Yeah, we can have medical report, we can have fit to fly issued by treating doctor. We use IATA guidelines, we use MEDIF and medical clearance, and all it helps us to decide if patient's fit or no. There is like typical example of fit to fly recommendation form. So dates, admission, vital signs, when patient is fit to fly, what is the mode of the flight, and if required oxygen, what kind of transport to airport, what kind of wheelchair, what kind of escort. It's a basic one. It may vary country to country, hospital to hospital, doctor to doctor, but it's just a basic when we can find necessary information to arrange the flight. Most important thing is functional assessment. Yeah, we've got fit to fly on the paper, but coordinator should call the patient and ask some questions to be sure. Yeah, and let's discuss all together why we need these questions. Okay, if patient can sit upright and how long? Why we need this? Yes. If patient cannot sit upright for at least half an hour, it will be stretcher. If he cannot sit for more than hour, probably we will need to arrange business class or two expresses to let him lie down. Okay, second question. If patient can walk and how far? Why we need this question? Yeah, so wheelchair, we discussed category of wheelchair. Yeah, if patient required, if required wheelchair or no. Yeah, if cannot walk, probably we need to think about what kind of escort supposed to be. Okay, question number 3. If patient can eat and drink, why? Yeah, it's important for escort. If patient cannot eat and drink, and we already discussed that patient need to take medication, fluids, so we need to provide the escort. Yeah, if patient can eat only with the help of husband or wife, it will be non-medical escort. But if patient cannot eat at all and require nasogastric tube or IV access, it will be medical escort. Okay, and fourth question, if patient can go to toilet. Yeah, definitely. Yeah, if patient needs just support, go to toilet. Yeah, it will be non-medical escort. If patient with a Foley catheter, it should be at least a nurse. Yeah, because I'm not sure if in couple of 80 years old Germans, someone can manage a Foley catheter if something happened. Okay, good. That was a functional assessment. So now we move to MEDIF and medical clearance. When we need MEDIF and medical clearance, all stretchers and all oxygen cases. WCHC, so it's wheelchair to sit, yeah? Because probably something wrong with the patient that he is not able to go like this 30 meters, yeah? For Finnair, they require medical clearance for any kind of wheelchair, so if you are arranging flight to Finland, try to use other airlines because some delays may happen because they are not working some days, and just because of wheelchair, easy to find another airline. MEDIF consists of few parts, usually part 1 to be completed by a sales office or agent or patient or travel agent when we put booking information over there. And part 2 should be completed by attending physician. It also can be done by our doctors because for airlines is most important correct information. If you've got enough information from medical report or from medical contact, we can put everything into MEDIF and apply for medical clearance in airlines. It required 3 to 4 days to be confirmed. Some airlines can do it faster, like Turkish Airlines. Some airlines can take 5 or 7 days, like Emirates. Yeah? But again, usually it's 3-4 days before we can arrange flight with a medical condition. So please not promise the patient if he requires oxygen that okay, we will buy tickets with oxygen for you tomorrow. No, it takes the process, it takes time for approval from airline medical desk. And don't forget about transport to and from airport. Yeah, it can happen with a comfortable car, which is like will be GT, ground transport, normal car, limousine, van, VSL. So when patient not requires some special condition or special equipment, yeah, he can sit quite comfortable in normal seat, yeah, and no need escort. Or ground ambulance, yeah, ground ambulance can go quickly, patient can lie down, so for all stretchers, for all oxygen cases. When patient cannot walk, so it's WCHC as well. Or when patient required monitoring, or patient in Jakarta, Manila, or Delhi, or other countries with a bad traffic. As example, in Manila, if you will go from one hospital to airport, if you will go by ground ambulance, it will take 20 minutes. If you will go by normal car, it will take 3 hours. So sometimes better to be sure the patient will get airplane and arrange ground ambulance. And example that ground ambulance it's not the same in countries. Yeah, here is in Bangkok. So Bangkok Hospital Group got motor ambulance as a first response, and here is Dubai. Yeah, they also got first response on Lamborghini or Lotus. So sometimes we need to specify what kind of ground ambulance. So usually we've got basic life support, BLS, when we've got driver, paramedic and some basic equipment, or ALS, advanced life support, when we've got a doctor on board, paramedic, driver, when we've got equipment like IV fluids, defibrillators, oxygen. In some countries, ALS is the same as ICU ground ambulance. So it may vary. If you are not sure, you can ask our local offices and they will help you to clarify. And again, ambulance can range country by country. And one of my favorite picture, yeah, it's somewhere in Africa. Okay, what do you think? Is it BLS or ALS? Oh, locally ill. Maybe. So again, please clarify. Please try to check with local office that this cow you've got some medical diploma. Yeah. In some countries, when there are not so many roads, we will have a hydro ambulance. Yeah, here is example of Venice. Yeah, so it can be ferry, it can be speedboat, it can be water taxi. Usually it's island destination. Their performance depend on weather condition, and in some places it's alternative to helicopter. As example, Gili Island to Bali, yeah, in Indonesia. And let's discuss about helicopters and airplanes. Helicopters, it's usually primary response. It's local emergencies. They can have access to some rural areas or locations, yeah, oil rig islands, somewhere in downtown when it's not possible to go because of traffic. But from negative, it's vibration and noise. It's a short range. Yeah, you cannot fly for 1,000 miles, and it's not pressurized, so patient will suffer from effect of the atmospheric pressure change. And fixed wings, yeah, it's normal airplanes. They can fly long distance. Some air ambulances can fly for 10,000 kilometers, yeah, within one flight without stops. It's more space, more equipment. It's really ICU in the air. It's less turbulence. It's pressurized, so patient not suffering from these effects. But it needs time to arrange it. Yeah, it's airstrike dependence. One example. Let's go to Thailand. Yeah, we've got Rayong, which just 200 kilometers away, and you can arrange ground ambulance. You can arrange helicopter, and you can arrange airplane. Yeah, if you're using airplane, it will be half an hour to airport and from another airport and the flight. But it will be faster? No. If you will use helicopter, you will land in the hospital, pick up patient and go to receiving hospital in Bangkok. Yeah, and it takes 2 hours because a helicopter needs to fly there and back. Or ground ambulance. Yeah, ground ambulance go directly. Yeah, so sometimes helicopter it's alternative to ground ambulance. So in that case, probably ground ambulance will be more cost effective and less time consuming because we don't need to send the ground ambulance from Bangkok to Rayong and from Rayong go back. Yeah, we can use the ground ambulance from Rayong directly. So that's helicopter and airplanes. But for example, we cannot send a helicopter from Thailand to Europe. That's logical. That's helicopters, how it looks like, somewhere in the mountains. That's how it looks from inside. Actually, it's quite big helicopter. So it's some basic equipment. And here, helicopter can be landed on special platforms. Or you can jump from helicopter. And here is an example. My first flight on helicopter was that I should jump in the traffic jam on the truck roof. Yeah, I prefer fixed wing aircrafts like after that. Yeah, it was my first experience with helicopter, and in case of I will need to work with helicopters, I will try to avoid it. And here is a fixed wings, yeah, which I like more than helicopters. So here is the most common aircraft. It's Learjet 35. It's a turboprop aircraft. Here is how it looks from inside. Not that spacious, but all necessary equipment can be here. And here is an example of Russian government air ambulance. They can put small ambulance inside. They have 13 beds of ICU patient inside, but it's flying garage. It's noisy, it's cold, it's terrible. It's Illusion 76. Yeah, and the most ridiculous part is the toilet there.
Why?
There are no toilets. Okay, but by the way, in this Learjet they don't have toilet as well. But actually they've got toilet under this seat. So if you want to do, you should do it in front of everyone. Let's go to plan of action. Yeah, plan of action. Yeah, what we supposed to do to arrange the transport. Yeah, we should start to create a plan of action as soon as we have a fit to fly or preliminary flight restrictions. Because it's quite expensive arrangements, we should confirm with the senior assistance person and medical team. We should include all tickets and all check-in times. Yeah, now we have a good tool, amazing tool, travel planner, which you can discuss later with transport team. All should be confirmed with escort, even sometimes the hotel. Ground transfers, we should put name of the provider, so like probably name of the driver, plate for access to airport. We should have all contact numbers, yeah, including local agents. We should finalize plan of action before escort going to depart. Yeah, so we should have it in advance. If we not have a medical clearance from airlines, better to wait 1 day before we will have a medical clearance. we should put progress, yeah, in our communication, yeah, so it should be mission notes. And because we are working with big insurance company and small insurance companies, we should notify sometimes customer when we finalize the mission, or when it's media case, or when it's complicated or complaint case. What shall we check? Yeah, it's our checklist to be sure that mission's gonna in the right direction. Patient passport and patient visa. You say, oh, it's normal, yeah, the patient should have a passport and visa with him, they travel, yeah? No, because sometimes patient can lost passport, passport can be stolen, visa can expire. Same with company. I will tell you the story. Once, for one assistance company, I arrived in Vietnam to pick up the patient. It was a stretcher and oxygen case, and we met in airport. So I took my passport and patient passport to get immigration clearance. They stamped my passport just immediately, and with the patient passport we have a problem. Because patient was admitted in Vietnam for 4 months, and during that time visa expired and passport expired. So when I asked, okay, what shall we do with this immigration officer? He said, nothing, don't worry. She will go to the jail for 2 weeks, and after that she can be deported. And I'm just trying to imagine, okay, patient with oxygen, with a stretcher, yeah, she will go to Vietnamese jail for even like 1 day, she will die over there. So, but thanks God it was Vietnam, and $100 under the table helped everything and solved the problem. But it's not part of the training, yeah? We should know that patient have valid passport and valid visa. Okay? Okay. Same with the companion. Luggage. Number, location, type, yeah? Location, yeah, we should not ask our escort to try to find somewhere in middle of nowhere where is patient luggage, yeah? We should know about it. But what about number? Because air ambulance, they've got limited space, and sometimes we should decide if air ambulance will take luggage or patient companion. Yeah, so we should clear it before we will dispatch air ambulance, and it should not be complaint, should not be a problem that family or patient should decide who's gonna fly. They should know it in advance. So we should have a travel recommendation. We should have a airline clearance, yeah, when it's required. We should present a quote, yeah, when insurance company should confirm, yeah, we're gonna pay for a mission. We should have a go ahead, if it's expensive, so from our general managers. We should have an escort. We should place guarantee till discharge to the hospital, and we should notify hospital about the mission that we're going to pick up the patient. Why? Because once I arrive to hospital in India, and because it was a problem with local agent and everything, me as a escort need to pay for admission. Otherwise we will lose the mission, yeah? No one will send a guarantee, nothing. So please place guarantee until discharge, and inform hospital. Yeah, you should not be surprised that patient in ICU or in the surgery room and escort arrive and say, oh, we are flying in half an hour. No, no, please be sure that hospital know about it. Consent for air travel, yeah, for the mission from the patient or from the family. Because they should agree, yes, I want to fly. We should not like move patient because they don't want. Because he's not going to be accepted on board. He's not gonna have medical clearance if you don't want to fly. Yeah, we in normal world. Why it's important? Once I arrived to Bali to pick up the patient, very nice British lady with some psychiatric issue, but we decided to move her back home. She'd been on cruise, and because of mental illness, she'd been disembarked. And when she became stable, we arranged everything. We do everything's good. I came to pick up her and said like, okay, we're gonna home. Yeah, good. How are we gonna back home? Yeah, back to London. We have a flight in 3 hours. What? And she just lie down. I'm not gonna fly. No. And she's been like 70 something, and she never fly in her life because she's been extremely crazy about flight. She's scared. So, and no one from coordinators informed her that you're going home by flight. Yeah, we should inform the flight plan. Yeah. And I need to discuss with this lady, like, don't worry, nothing, we fly in business class, I'm a doctor, I'm gonna support you during the flight. She started to trust me, we start to communicate, but still trying to avoid this flight and say that, I've got like a world cruise around the world, because I wanna travel, but I cannot fly. I started to negotiate with her, it was quite problematic, and she asked me, oh, you've got like a very nice accent, where are you from? I told her, I'm Russian. And she's scared probably just the two things in her life. It was scared of flight and Russians, yeah, but scared of flight over here, Russians over here. Because yes, and because after that she was such a nice lady. Yeah, she stand up. She just like asked, okay, can I go to the toilet? Yeah, everything's good. Yeah, amazing. Yes. And when we arrived to Heathrow Airport, her daughter said like, how you did it? Yeah, she's like never flown for the last 70 years. I told her, because we are professionals. Yeah. So, but we should avoid these kind of situations. So, please get a consent from the patient before the flight. So, we should reserve the flight. We should get tickets to be issued, not just the booking, because booking can disappear, but we should get confirmation that tickets are issued. Ground transport departure and location for escort and for the patient. Hotel for escort if so required. Ground ambulance in arrival and departure or maybe transit. Hotel for escort on arrival and something else. Yeah, because each checklist can be expanded. Okay, and we are here. Any questions? Okay, so now you know how to arrange medical transport, yeah, and what we should know. Yeah. So if you will have any further questions, please feel free to send me emails or call me. We can discuss. In terms of work, you can always assign tasks to me if you need some opinion about medical transport or some alternative. Always happy to help you. I hope we will have this course recorded in our Illumi educational platform. And this kind of global training is just the first step. So we will have another topics like orthopedic or emergency medicine soon. So thank you everyone to participate in this training. So keep in touch. Yeah, and have a nice flight. Yeah.